Let me start by thanking everyone who's come to the webinar today. It is my absolute privilege to serve as the CEO of the Medical Council of Canada. And I want to start by really thanking all of you for joining today. Thank you for your dedication, your commitment to wanting to serve patients in Canada. And I want to thank you for continuing on that journey. The Medical Council of Canada, I'll say quickly, is certainly committed to serving all of our candidates. And many of those candidates are you, international medical graduates, internationally trained physicians, and we have that commitment. Today's webinar is particularly special to me for a couple of reasons. One is there's a lot of talk about the needs in primary care, and they do exist, but those needs also exist in specialty care. Number two is, as we are doing our best to serve our candidates, all of you, we are hearing questions about specialist routes to certification and licensure. And so this is an important area for us to address. And number three, as an anesthesiologist myself, obviously specialty care is near and dear to my heart. Luckily, we have some extremely talented experts with us today. I want to first welcome Chantal Benoit, who is a good friend as well as a colleague with tremendous expertise and wizardry in the area of credentialing, and works at the manager of the credentials unit at the Royal College of Physicians and Surgeons of Canada. That credentials unit resides in the Office of Standards and Assessment. And Chantal certainly knows her stuff with over 20 years of experience in the credentialing of specialists through the Royal College. Next, I want to also welcome yet another friend and colleague, Ms. Corinne de Bruin, who is the Executive Director of Registration with the College of Physicians and Surgeons of British Columbia. Corinne graduated with a Bachelor's of Laws and has been a long-serving British Columbian in that province. And her role is very much related to registration, which is related heavily with whether or not whether person gets licensed to practice in the province of BC. And lastly, and I know I'm going to see many hearts aflutter here, I'm going to introduce Dr. Filipe Santos, who whether or not you knew, arrived in Canada in 2017 after completing medical school, his residency training, his PhD in pharmacology in Brazil. And don't be embarrassed by all the hearts fluttering away there for Dr. Santos. He's currently working as a Royal College certified anesthesiologist in the University of Toronto at St. Michael's Hospital. And as you know, we have been very fortunate to have Filipe join us here at the Medical Council of Canada as our advisor on international candidates. So I want to just start by recognizing this is an hour-long webinar, and I want to be clear that in an hour, I'm sure we're only going to get to the tip of the iceberg of many of the things that you have questions for. It's very difficult in an hour to touch on every nuance in specialty certification and routes to licensure. But what we're going to do today is certainly cover the main routes to licensure and certification through our experts. And what we're committed to doing, as Meredith mentioned, is following up on your questions. And and when need be, perhaps have another one of these webinars. So we're committed to getting the information to you in this rapidly changing field. So I want to start by diving right in with our panelists here. I'm going to start by giving them each a little opportunity to explain where they come from. And I'm going to start with you, Chantal. And just ask you, so that we all understand the Royal College of Physicians and Surgeons of Canada, just understand that organization and understand the credentials unit and how you support internationally trained physicians.
Thank you. Thanks for the intro, Vern, and thank you, Medical Council of Canada, for putting this together. And I definitely love seeing those hearts for Dr. Santos. I had the pleasure of seeing him live at the IMG conference, and I definitely see where all those hearts are coming from. So I'm happy to be here today to talk about the Royal College and, how we can support IMGs through the process and hone in a little bit on what we do and why. Um, I'm hoping to make things feel a little bit less overwhelming during this process. But the Royal College is Canada's official body for assessment and certification. What I want you all to know is that we are committed to supporting international medical graduates throughout their journey from application straight through to certification. We really recognize the vital contributions that international medical graduates have on the Canadian healthcare system. We want to provide clear guidance on eligibility and application requirements. We offer as much as possible personalized support to help navigate the assessment and examination process. We want to promote fairness and transparency and equity, uh, um, allowing IMGs to integrate successfully into the medical system. Specifically, the credentials unit, my team at the Royal College is responsible for reviewing postgraduate training from around the world to determine whether a candidate is eligible to challenge the certification examination in their chosen specialty and their readiness for certification thereafter.
Thanks, Chantal. Now, just so everyone's on the same page, when we talk about specialists in Canada, what does the Royal College, again, for people who might not be in this country, what specialties do they oversee?
So we are responsible for all primary and subspecialties, not for surgical and medical specialties, not family medicine. So that's an important point for all of you to know. And I did see a few things in the chat there about family medicine. We are not responsible for assessment and certification over family medicine. We would definitely send you over to our colleagues at the College of Family Physicians of Canada, and they do also recognize and have routes to certification for family physicians.
Sure. And so, somewhat unique in the world, I know, maybe there's 4 or 5 jurisdictions. All of the specialties live under the roof of the Royal College of Physicians and Surgeons of Canada.
Yes. Yes.
And Chantal, as we are going to move on to our other panelists, you've mentioned many times certification. From what is the difference really between certification and licensure? So, what happens at the Royal College versus an actual license to practice?
I'm glad that you mentioned that because we want to clarify early on the difference between certification and licensure because they sound similar, but they serve very different purposes. And it's a common source of confusion. It's something that we see daily. We, the Royal College, are handling examination eligibility and certification. That means we are assessing training. If deemed comparable, you're getting access to the national exams and then leading to certification. Licensure, on the other hand, is what gives you the legal authority to practice medicine in a province or territory. That is handled by the provincial medical regulatory authorities. So, for example, I'm going to use BC since we have Corinne on the panel today. If you want to practice in British Columbia, that's in the hands of the College of Physicians and Surgeons of BC. So you would be applying through them for a license to practice in that province.
Well, since you brought in my colleague Corinne, I guess we should go to her and really just jump on that, Corinne. So, how do you interplay with the Royal College of Physicians and Surgeons in Canada? So now I'm a candidate. I'm done the things that Chantel's asked to do, but how does the College of Physicians and Surgeons of British Columbia look to the Royal College to make those licensure decisions?
Yeah, great question, Varen. I think the key is that for us as a jurisdiction, and I would just want to emphasize that in each jurisdiction it's different. So it's really important for the attendees to know that if you're looking for a route to licensure, make sure you look at each province and territory, because some things are the same and some things are not. But really what we do is we look to the Royal College and say, okay, what are they assessing in terms of education? What kind of routes do they have to assess that? And would we accept those routes as making a physician who meets that requirement with the Royal College in terms of that credentials assessment? Would we recognize that in order for that physician to become eligible for registration and get licensure as a specialist in BC? So that's the interplay. So we really look to the Royal College to do that assessment of credentials and education, and for them to say, yes, we believe this physician is eligible to write this exam, and we'll say, okay, we'll take that. And they either can get an independent license with or without sponsorship or supervision. So hopefully that
And,
helps.
and yeah, and Corinne, while we're here, I know obviously certification, education equivalency examinations are one part of it. What other things might you look for in British Columbia or maybe some other jurisdictions about a person's eligibility to practice?
Yeah, for sure. So we just really look at currency and practice. So we make sure that in the last number of years, there has been a component of practice that does vary by jurisdiction. We look to see that they're of good professional conduct and character, and that we get, if you've been a physician elsewhere, which most attendees have and are, then we ask them for a certificate from their latest, like from where they've practiced in the past, just to see what their practice was, if there are any issues that came up, complaints or things like that. We also mandate English language proficiency because in BC, for example, all medical records need to be in English, whether it's an electronic medical record keeping or otherwise. And so those are just some of the things we look at. We used to ask for references. We actually just eliminated that requirement. And it's actually making our applications process much faster.
Great. Well, I'm going to come back to you in a second, but I'm going to go to my colleague, Dr. Santos. And Filipe, you've heard Chantal describe the Royal College certification, a pathway to licensure, and we've heard about one jurisdiction in British Columbia, and Corinne has correctly articulated that things are a little different from province to province. But as a person who helps IMGs navigate some of this. Are there any other emerging routes to licensure for specialists that you know of in the different jurisdictions?
Yes. So I think what people find most confusing is really understanding that dynamic between certification and licensure, and the fact that we have 13 different provinces doing licensing very differently with different criteria. So yeah, one of the processes is the practice eligibility route that Chantal was mentioning is a route to certification for you to become recognized as a specialist and have a certificate from the Royal College and accreditation, a certification that you are licensed to that you are capable and you pass examinations, you're certified by the highest body that certifies specialists in Canada. But it's national, so that certification works for all the provinces, but it doesn't automatically reflect into licensure. And what happens is the provinces will look to that process, and each province might look to that process in different phases. So some provinces might look at the very end when you're fully certified by the Royal College, but some other provinces might look at earlier stages in that process. So it's a 4 to 5 step process. So there is when you ask me, like, are there other pathways? There are many pathways that derive from the PR, and it's in different stages. So, Nova Scotia or the Atlantic provinces might look at an earlier stage, Ontario in the middle, BC, Saskatchewan, Manitoba might look a little bit later on the process. And ultimately, all the provinces would accept if you have the full certification of the Royal College and you have the full certification of the Medical Council of Canada. Aside from that route, briefly, there are other pathways such as academic license, and in some provinces there are specific licenses you can apply for that do not depend on this assessment pathway of the Royal College, such as applying for a practice ready assessment as a specialist in Alberta, Manitoba, or Quebec, or a special license, for example, in New Brunswick, which you may be able to be eligible for. Aside from some provinces such as Nova Scotia that will give license to specialists coming from some countries. So if you're licensed to practice in the UK, New Zealand, or Australia, for example, Nova Scotia would be able to review your credentials and you might be able to apply for a license there, regardless of the process of the Royal College.
So we'll come back to that in a second, and we do have questions coming in fast and furious, which is wonderful. I'll remind audience members, it's very difficult in an hour-long webinar to comment on individual cases, and in their chat, you'll see directions of contacting the Royal College directly or other resources. But Filipe mentioned, and we're going to do our best. We sometimes get tangled up in our TLAs, or three-letter acronyms. He mentioned PER. So I'm going to come back to you, Filipe. I'm going to go to Chantal. Chantal, PER, can you unpack what those three letters mean and what the route to certification by the Royal College is through the PER?
Yeah, for sure. So the PER is the practice eligibility route. And it's a route to certification that evaluates the credentials of international medical graduates and provides a process to ensure that they are certified, supported, and adequately prepared to serve patients in Canada. The Royal College, and I think this will address a lot of the questions that are coming through in the chat, we recognize specialty training worldwide under this route. So I see a lot of questions about, I did my training in Nigeria, can I apply? I did my training in Lebanon, can I apply? The answer is yes. As long as you completed specialty training worldwide, you are eligible to apply for an assessment to determine examination eligibility. Our role is to make that determination by saying, yes, either you're examination eligible, and if not, what needs to be completed in order to become eligible.
Okay, so some of what you're getting at is the realities of breadth of specialty. So, I'll use my own specialty of anesthesiology. In Canada, we do a lot of chronic pain as part of the anesthesiology specialty. What if I'm from a country that maybe doesn't do chronic pain as part of its specialty training?
So through our role in assessing the postgraduate training that IMGs have completed, we're looking for substantially equivalent. We recognize that training across the world is not going to be exactly the same as the training that is received here in Canada. So we are doing an in-depth evaluation of the training that IMGs have received, understanding that it's not going to be exactly the same. So what we say is substantially equivalent. So maybe most, but not all of the training has been completed. So we're looking for two different things. We're looking for length of training and content of training. So when we talk about pediatrics, for example, being 4 years in Canada, that is the one piece that's non-negotiable at this point. So candidates have to have 4 years of training in pediatrics, but what there may be some flexibility in is the content of that training within. So we're looking for substantially equivalent.
And Filipe, you had some comments around this question as well.
Sorry, I was muted. Sorry, I just want to briefly touch on a very common question that I get from internationally trained physicians all the time. The Royal College, when they do the assessment, Chantal, please correct me if I'm wrong, when they do their assessment for training under the practice eligibility route, they are assessing your training. They will not look at work experience. They are not responsible for currency of practice. They're not looking for English proficiency. All these might for sure will be important when you're looking for licensure. But to assess whether or not you're eligible for examination by the Royal College, these factors do not play a role. So you can apply for the assessment of your eligibility even if you're out of practice. You can apply for the assessment even if you are didn't do your English proficiency exam yet, or if you are not in the country. This is accessible worldwide. However, you need to keep in mind, and I always suggest, that you understand what you're going to do with the eligibility letter should you be granted eligibility. So why are you applying for this? What is your purpose? So that you can prepare, and all these other pieces, even if you don't need them specifically to apply for the assessment of the Royal College, they might be crucial and very much needed when you go to, for example, the College of Physicians and Surgeons of BC or any other of the medical regulatory authorities and request your license to practice. And that certification, that process that you do at the Royal College does not automatically translate to license. And that is a very common misunderstanding. Same with the LMCC. A lot of people think that after they pass the QE1 and they get their licentiate of the Medical Council of Canada, that will translate into licensure. It may, depending on your situation, but it does not automatically.
Chantal, do you have any comments to Philippe's comments?
Oh, I think I want to say thank you for mentioning that. It is very important to note that yes, we are strictly looking at postgraduate training towards examination eligibility, and review of anything else is not in the role of the role of the Royal College.
So Filipe is starting to unpack the interplay between Royal College certification and licensure. I'm going to come back to you, Corinne. So now, we see that there are elements to licensure, again, jurisdictional specific language, plus minus LMCC, plus minus. There's often the question, though, that, here I am, I have my Royal College certification, Chantal has given me eligibility, I've written my exam. For licensure to occur for an IMG, does a person require a job in the health authority or in the province prior to licensure? Or is that an enabler for licensure? And again, recognizing just BC is what we're talking about with you, but even if you have information from other jurisdictions.
Yeah, for sure. I think that in many jurisdictions, if you're an internationally trained physician and you don't qualify automatically for a license without sponsorship and supervision, which is generally the case, you will need the sponsorship of like a health authority, which is the body that is responsible for employing physicians in the healthcare system. Sometimes it's just hospital, sometimes it's acute care settings and community. And so in BC, generally you do need a job. We have an organization called Health Match BC that lists a lot of jobs that are out there, and also individual health authorities list jobs. So don't let that be a barrier. Like even if you start the process, like Filipe was talking about, there's all these pieces, right? Like it's not just the Royal College assessment of training. There are all these like currency, like connect with the jurisdictions you're interested in, figure out what you need in the big picture. One of those pieces will likely be a Royal College like assessment through a route. But also figure out, do I need a job sponsor? You can find out, like in BC, we issue what we call a preliminary assessment. It tells you exactly what your licensure, you're going to be eligible, but you're going to need to do A, B, C, D, and E. And oftentimes that includes having a sponsorship letter, which means you have a job offer from a health authority.
Right. And again, just so clarity for people on the call, sponsorship is equivalent to a job offer, is essentially.
Exactly.
You're using the words
Thanks for clarifying.
similarly. And Filipe, you're helping a lot of people through this. So let me ask a difficult question. Job offer first or Royal College eligibility first?
So it depends a lot on the province. So usually you need a job offer first, okay? But there are exceptions. So for example, if you're from an approved jurisdiction, which includes around 29 jurisdictions, if I'm not mistaken, Chantal knows better, that the Royal College recognizes their training as equivalent. And it's important to understand that this equivalency is not only by country. So we say 29 because it depends on specialty, depends on year that you completed your training. So it's very specific. This document is live on the Royal College website. If you did a training on one of those specific jurisdictions, some provinces like Alberta might give you a licensure before your job offer. But typically for IMGs that are not from approved jurisdictions, you will require at least 1 year of supervised practice as the most responsible physician. So it's very different, just to clarify again, because this is a very common misunderstanding. One thing is supervision, like a distant supervision where you are a most responsible physician. The way that supervision looks like is that usually the supervisor will do some chart reviews every 2 or 4 weeks and report back to the medical regulatory authority of that province, but you are independent in the moment of doing the management, or diagnosis, or assessment of the patient. When we talk about supervised licenses on a limited role, such as associate physician, you are supervised on every patient during the process, for example, of patient care, not only on chart reviews, and you're not the most responsible physician. And the reason why this is important is because when you look at the requirement of whether or not you need a job offer, so for associate physician roles, you always need a job offer first. For as a most responsible physician, it varies. If you are from approved jurisdictions, you may not need one, but ultimately, and just to make it easier for everyone, it will most likely start with the job offer.
Okay, I think that's clear. I'm going to come back to this in a second. I'm going to ask my colleagues in the back room to post the link to the 29 jurisdictions, approved jurisdictions for the Royal College, which, as Chantal will attest, those are approved jurisdictions where Royal College eligibility is granted because of substantial equivalency having been decided a while back. Chantal, I'm going to come back to you. One is just to say a word or two about the approved jurisdictions,
Yep.
And then also some recognition of what happens after exam eligibility and examination to become a fellow of the Royal College.
Okay. So to give you a few points on the jurisdictional route, as Dr. Santos mentioned, there are 29 international jurisdictions that the Royal College has deemed as recognized or approved for application through. But the training has to have been completed within that jurisdiction, within the approved time frame, and within the approved specialty. So those three things are the most important to remember, and that information is found on the link that will be posted in the chat. We still have to conduct an assessment of training on that. So examination eligibility is not granted solely on the fact that the training was completed in that approved jurisdiction. So we're still looking for those same things of length of training and content of training. So we're still doing that deep dive to make sure that all of those elements have been met and that the training is substantially equivalent. With the jurisdictional route, once a candidate is successful at the examination, certification is granted, and candidates are invited to be fellows of the college. There is a difference with the practice eligibility route. With the practice eligibility route, upon success at the exam, we do require 2 years of practice in Canada to be completed prior to certification. So success at the examination, 2 years of practice in Canada. Once that is confirmed, we then grant certification and invite candidates to be a fellow of the Royal College.
That's great, Chantal. I'm going to stay on jurisdictional route for a second, but I want to just clarify one thing. You mentioned again checking content and length in specialty training. So what if a person is 6 months short? But how do they close that gap, or how does your office help them identify to close that gap?
So if we notice that training is missing and there is a gap, we will specifically indicate what that is and point to that section of the requirements so that it's very clear what the person has to go and do in order to then be eligible. In a lot of cases, docs come here and do start a fellowship or do other training in their own countries of origin. So I think it's important to also note when you send in that application, we want to know everything that you've done because it is possible to look at some other things, research years, fellowship years, subspecialty training that may be able to close that gap if there is one. But if we've taken everything into consideration and there is a gap, we will then send you off with a letter that indicates exactly what that training is that should be completed. And that training can be completed either in the country of origin, in Canada, in the US, in one of the 29 international jurisdictions as well.
All right. Now you've dropped a few key words there. I'm not going to let those bypass, like fellowship. And I'm going to come to Dr. Santos in a second. I know he's got his hand up there. I'm going to go to Corinne for 1 second before we leave jurisdictional routes, because BC is talking about things. Certainly, colleagues just one province to the east of you are talking about jurisdictional route. Chantal has mentioned jurisdictional route, which we posted in the chat, deems if training is equivalent, that the person is automatically eligible for the Royal College exams, but other changes are coming based on those jurisdictions. So Corinne, sorry, can you comment on some of those changes that are being discussed or in motion?
For sure. So I would just say that currently out for consultation, we have proposed bylaws that are out for consultation till the middle of September, and that would come into effect closer to the end of the year. If there's no substantive issues. And they basically indicate that if you are a physician that qualifies through the approved jurisdiction route, or would, for an eligibility ruling, that we would recognize that they could apply for the full independent class of licensure. And we wouldn't even, under that process, mandate them getting an eligibility ruling letter. We'll do that assessment internally to see if it matches the approved jurisdictions. So that's really a huge shift. We've just recently done that for US trained and board certified, and they are now eligible for the full class, and they don't have to sit at the exam ever. And the same thing under the proposed bylaws. They already have certification in their home jurisdiction where they obtained their certification and did their training, and they do not have to sit the Royal College exam.
Okay, so again, just for clarity, for this group, if they choose, although there are benefits to fellowship and certification, which we'll probably not touch on today, but you wouldn't, if you're from these approved jurisdictions, what we're seeing emerge in BC out for consultation, approved in Alberta, is training and certification from an approved jurisdiction does not require eligibility from the Royal College or examination from the Royal College to move to full licensure.
Correct.
And just because you, again, dropped a few keywords, so I haven't forgotten that fellowship one, we're seeing a surge of interest from our colleagues in the US. Could you comment first on BC about US interests, and also, you know, while I know and I won't hold you to it, I know you can't speak for the other provinces. Certainly some, I'd say some general consensus around approaches to the US, if you can, across the country.
Yeah, for sure. I would say BC was not a leader in this space. I think most other jurisdictions across Canada actually recognize that if you are US trained and certified, you're eligible for the full class. And so we've just, that came into effect July the 7th. And I can tell you that we've had so far, that's last week, 25 applications and 2 registrants already. So in that time period, so that's pretty impressive. The biggest challenge so far has just been the work permit piece. So, but even the federal government's working on that. So we're seeing some movement there.
Yeah, so essentially we're seeing the emergence across Canada of essentially reciprocity, or one-way reciprocity, I'd say, for US licensed doctors to come across. And just to know that certainly the Medical Council of Canada is working hard with the federal government around the bottlenecks in immigration, which I think is what you're outlining as one of the larger challenges. So Filipe, I'm going to come back to you. You've heard about approved jurisdictions. I don't know if you want to comment any further on that, but Chantal also mentioned fellowship. Fellowship is an interesting word. It has many different meanings. There's fellowship with the Royal College, which is essentially membership with the Royal College, for lack of, but there's also a training fellowship, but where people come for essentially subspecialization or super specialization training in Canada. How does that play into the routes to licensure?
Yeah. So first, yeah, I just want to clarify the word fellowship. In many countries, fellowship is referred to as it is for when we're a fellow of the Royal College as a member, as you said. However, when it comes to training, there are 2 main types of fellowship training, which is usually a training that you do, a further training that is in a scope that is a little bit more narrow than your primary specialty, and it can be either clinical or research, and sometimes both. To know if it's clinical or not, it basically depends on whether or not you have a license with a medical regulatory authority to practice medicine, which would be an educational license. Some research, like exclusively research fellowships, fellowships that are exclusively research in nature, they do not require a license with a medical regulatory authority unless patient care is going to be involved. That said, how does this play a role with licensure? So there's 2 pieces of it. One is that some and quite a few of the specialties of the Royal College, when you look at the standards of training requirements, which is the document that the Royal College will consider as being the Canadian training standard, and which they will assess your training against. A lot of the specialties have room to accept fellowship training up to a year as being part of your training that you need to be able to be considered eligible or not for the exam. So an example would be like an anesthesiologist that does 4 years of training in a country and then comes to Canada and does a fellowship. They may be able to use that as the 5th year. And I say may because they need to have done a significant portion of that fellowship in the general scope of that primary specialty. If it's very, very narrow, they might not be able to use it. And then people get really confused as whether or not they can use that year as well as practice, because Chantal just mentioned that to go to certification, you need to have 2 years of practice in Canada, and sometimes you can use 1 year of fellowship. So if you already use that 1 year to get eligible, so let's say the anesthesiologist did 1 year fellowship, needed that as the 5th year to become eligible, they cannot double dip. They cannot use that year as the 5th year for getting eligible and as the 1st year of practice. So they're not able to do that. But if they have 2 years of fellowship, they may, under review, have 1 year counted towards the training, 1 year counts for the practice. So the fellowship has played a very important role in getting IMGs licensed, or ITPs licensed, internationally trained physicians licensed in Canada, because not only it has helped a lot of people achieve the time in training that they need to be exam eligible by the Royal College, but it gives you a transition to practice in the Canadian healthcare system. It gives you reference letters from Canadian physicians, and it puts you in contact with your specialty network in the country, which really increases the chance of job opportunity significantly. And as we talked before, the job offer is very important for the medical regulatory authority to be able to grant you that supervised license you will need for the first or between 1 to 5 years, depending on what's the route to the
Well,
you picked.
you've said a mouthful there, Philippe. So now I'm going to really put you on the spot.
Sorry.
Before I asked you Royal College eligibility or job offer, now I'm going to throw another onion into the mix here. Royal College eligibility, job offer, or fellowship opportunity.
Yes. So fellowship, I think it starts, if you can, you should start with the fellowship. The reason I say that is because it is very difficult to transition directly to practice, even if you're excellent specialist back home. I say this as coming here after I had already 4 years of independent practice in Brazil as an anesthesiologist, and during the transition to fellowship, it was tough. There's a different culture, different healthcare system. For me, I had never practiced medicine in English. I had to learn a whole new vocabulary. So there's a lot of challenges, and sometimes unforeseen, like people that are not here do not understand the challenges they will face until they get here. So a fellowship is a supervised training period where you will have more guidance and more support, and you will come out of that fellowship way better prepared to go independent into practice in your specialty. On top of that, I believe that a lot of the ITPs do not fulfill the requirements of the Royal College until they complete a fellowship. That is not necessarily the case. I'm just saying that there are many internationally trained physicians that maybe are not eligible before they do a fellowship, and they might be eligible after doing a fellowship. So maybe if you can't get a job offer, or if you're not being successful on your practice eligibility route application, you may, in many situations, be still eligible for a fellowship, and that might be a stepping stone towards independent licensure in the future.
And let me just ask you, Philippe, before I go back to Corinne and Chantal, where does one find these fellowships, or where be these fellowships?
So there's 2 things that are really important about fellowships. A lot of people say, I saw some people in the chat saying it's expensive. So first of all is that there are funded and non-funded fellowship positions. So some of the fellowship positions are not funded, requiring you to have a sponsor. When that happens, it usually is a governmental sponsor back home. So some of the countries have programs where they will send physicians to get trained here, and those countries will financially support them with salary, and also sometimes with agreements between the universities that might include financial agreements.
But aren't they expected to go home after?
Yes, so they wouldn't be able to do licensure here. They're expected to go back home. But I'm just saying that the difference between when when internationally trained physicians are looking for those fellowship positions, they may see some that say that they require sponsorship or they're not funded. That's what it means.
Okay.
Now, if you are looking for funded positions, then you need to see that means that you will get a salary. So many of the fellowship positions are funded by the groups or the hospitals or by different entities, and that means you'll get a salary. And where to find these? So usually my recommendation is that you go to the departmental website of your specialty in the Canadian Faculties of Medicine. So an example, let's say you do nuclear medicine and you're looking for a fellowship. Log into University of Toronto, look for the Department of Nuclear Medicine. Look there for the educational opportunities. Then you go to University of Ottawa and go to the big universities, because all the fellowships has to be linked, they must be linked to a postgraduate medical education office. And these are at the faculties of medicine. So all the opportunities are linked to universities. And if you go to the department of your specialty in those universities, the fellowship opportunities are usually listed there.
And just because I know people are joining in and out and may have missed it, what about research fellowships? Do they benefit in getting licensure? And I know you said it before, but I want to make sure, because often you see a lot of research but not clinical fellowships.
You got to be really careful with research fellowship if you're looking to have a license to practice clinically in the future. The reason I say this is because while you're doing research, if you do not have a license with a medical regulatory authority, you are out of practice. Even though you're doing research in a specific field, you're considered out of practice. If it's at 1 year, it may not impact you in the future, but if it's 2 or 3 years, it might start decreasing your opportunities for licensure in the future, because when you go to apply to a medical regulatory authority for clinical practice license, they're going to want to know when was the last time that you were practicing clinically. And doing clinical research does not qualify as clinical practice. That said, in some very few, and I want to highlight with Chantel here to underscore what I'm saying, very few exceptions, but there are some exceptions. There are a few specialties that recognize research fellowship to count towards the training requirements of your specialty. So there may be, for example, a physician that did 4 or 4.5 years of training abroad, that if they do a accredited research fellowship in a Canadian university with the postgraduate medical education office, with the certificate of completion and a letter from the research investigator, principal investigator, outlining the details of that research, and it's in the same line of your specialty, the same field, in some specialties, the Royal College may consider that training. So the reason I say this is because I've seen a lot of internationally trained physicians miss out on opportunities, including being eligible for examination, for not including all their training. And as Chantel said, include everything. Include your internship. If you did a master's or a PhD or a research fellowship, you need to include all that and leave it to the Royal College to assess it towards the specialty training requirements, because you may be missing out on opportunities by not outlining clearly what training you have done.
Wonderful. I'm going to come back to Corinne, and just before I do, I see some wonderful chats and wonderful comments, and too many hearts for Dr. Santos. But I will remind folks that it is difficult. I know there's a lot of nuances and individual cases and individual circumstances. We put lots of links up there of how to and who to connect with at the Royal College and here at the MCC, and we will work with you through your individual case, but it's difficult on this webinar to dive into individual cases. You can imagine the nuances. Corinne, back to you. Dr. Santos, you've heard it a couple times now, and you even said it. Eligibility beyond certification and so forth is there's a lot about recency of practice. Can you just explain what we mean by recency of practice? And in particular, I know there's sometimes some nuances between supervised practice and independent practice. And so how do we, why is that so important to the regulator? And what are some solutions when you see someone who's may have expired a little bit in that recency of practice?
Yeah, for sure. I'll just qualify this by just saying I'm talking about BC, but in BC, in the last, if you're applying for licensure in BC, our mandate is public safety. So we want to make sure that the physician who's going to be licensed is safe to practice and that patient safety is our priority. And part of that is that we say that in the last 3 years, you need to have practiced at least 24 weeks, 960 hours. So that could be in 3 years ago, and then you're almost in the next year and a half, let's say you didn't practice, you'd still be current. The great thing now is we're creating more opportunities for physicians who are not current to regain their currency. So if you are a physician specialist who may be eligible for the provisional class here, even though you're under sponsorship and supervision, if you're not current for practice, you can come up with a retraining program, put a proposal together, we will review it, and we will tell you whether or not you can proceed with that. You would then, if that's approved, go through on an educational license to do that retraining. If it's satisfactory, we would consider you to be current. Just recently, we made some bylaw changes that for the associate physician, which is not for independent practice, it's like you're working under an attending. If you are an associate physician and you're a specialist, you can also get retraining if the health authority, remember that's the person who's the organization that will be offering you a job, if they will support you in that retraining, they will put together what that retraining looks like. Could be 2 weeks, could be 4 weeks. If you then get licensed, you do that retraining, and then after that starts your 12-week evaluation in your associate physician role. So I think it's really great that we're creating more opportunities and pathways for physicians to regain their currency.
And just so, again, for clarity, different terminologies, associate physicians in BC are similar to clinical assistants in other provinces, if
Correct.
I'm not
Yeah,
mistaken.
that's correct.
And we've made a lot of this. Again, I applaud BC for the many routes to licensure. Practice ready assessment, I know, is a strong program in BC, but for specialists in BC, currently not the case, if I'm not mistaken.
That's correct. Only for family physicians at this time.
Okay. There are, though, as you will attest, PRA specialty opportunities in some other provinces, Alberta, Manitoba, Quebec, and it's certainly being looked at in other provinces as an expansion from the primary care. Now, before I leave you, Corinne, maybe this should have been the first question I asked and zoom out. I said earlier that a lot of focus has been on primary care because that is what our country needs and our patients in Canada need. But sometimes we overlook the realities that there are also needs in specialty care. Can you give us a little bit of a lens of perhaps some of the specialties in particular in BC again, so that you're not speaking for other provinces, but recognizing that there is some generalizability, the specialties that are of need in your province?
Yeah, I think there's a great need. So I would say to any specialist, just contact the jurisdiction and see if you have a pathway to licensure, see if you can get a job. But don't let what I say now now limit your opportunity. What we see is there's a real need in anesthesiology, medical oncology, pediatrics, and psychiatry. I think those are the big four that I see for BC that we get a lot of urgent requests for.
Okay, that's great, Corinne. And again, I'll speak more on the national scene. The other ones that we do see sometimes is internal medicine and geriatrics. And again, that's not to dampen any spirits. Those are just the highest need specialties. Certainly, we have specialty needs in all specialties across this country. And as Corinne says, to scratch at the jurisdiction you might be thinking about to see what the opportunities are. Chantal, I'm going to come back to you now. Filipe said a lot about fellowships, so those extra training things. And I just wanted to see if there's anything you wanted to add around fellowship and the role it might have in the path to certification at the Royal College or licensure.
Yeah, I mean, you really did a really great job on summarizing what fellowships mean to the Royal College and how important they can be in two different areas. And one of those areas is any potential gaps in training that are missing. So those that are in fellowship training positions in Canada, I would definitely make sure that we know about those when doing an assessment of training, because as Filipe said, oftentimes we can use those to fill that gap. And we also talked a little bit, or Dr. Santos talked a little bit about those fellowships being able to be considered against one of the 2 years in practice in Canada that we require for the practice eligibility route. So, in some cases, when the specific criteria is met for a fellowship, we can consider 12 months towards one. So, one of those 2 years of practice from a fellowship. The fellowship has to be a minimum of 50% of the time in the specialty in which you are applying for. So, if we're looking at a pediatrics application, it can't be a neonatology fellowship. We have to make sure that that fellowship, you're practicing in the breadth of the discipline. So a minimum of 50% of that time spent in the pediatric specialty. And if there are any questions about that, which there often are, we get a lot of questions daily about, I'm in this fellowship, can it count? What can I do? We want to talk to you one-on-one about that fellowship that you're doing and investigate it with you and see if it may fit the criteria that we're looking for.
And again, I know we have different people in different stages of all of this, Chantal, but and I know it's not really your box at the Royal College, but what after exam eligibility, just so people understand what the exams look like very quickly, what the exams look like for specialties that a person, because they can be very different than other countries.
Yeah, yep, definitely. For our certification examinations, we have a written and an oral part for most of the examinations that we host. So that is a written paper based examination. And then there is that oral examination, which is that interaction with an examiner and a candidate going through specific scenarios.
Great. And just by written, some specialties are short answer questions, some are multiple choice questions,
Yes.
some are a mix of the two. And the oral examination is really that sort of back and forth conversation through cases, often with an examiner that's pushing people a little bit to management of a scenario. Is that fair?
Absolutely, yes.
Okay. Filipe, back to you. I wanted to ask, we've talked a lot about PER and now and a little bit about PRA. I wanted to see if you had anything to add around the practice ready assessment route and the opportunities that exist in some of the provinces.
Yes. So the practice ready assessment is, as the name says, an assessment. So it's not a training opportunity such as a fellowship or a residency, where you will be evaluated throughout a period of time, which for specialists may be more than the 3 months that is typically done for family medicine. It can go up to a year. Where they will assess your practice and determine whether or not you're ready for licensure. The good thing about PRA is that it allows subspecialists that may not be eligible for the exam eligibility through the practice eligibility route that we were discussing. Some of these subspecialists may be eligible for a practice ready assessment. So I'll give an example. In many countries, cardiology has become a primary specialty, but in Canada, it remains as a subspecialty. So even if you did 5 years of training in cardiology, the Royal College cannot, it's not their, they cannot grant you exam eligibility for the subspecialty examination without you first being eligible for internal medicine, and you wouldn't be eligible for internal medicine because your training was in a subspecialty. However, if you do have, for example, 4 or 5 years of training in cardiology, you may be eligible for a practice ready assessment, for example, in Manitoba, potentially in Alberta or Quebec. It depends. The rules are a little bit different in each province. So for some subspecialists where the practice eligibility route may not be an option, the practice ready assessment might be an option. Another difference is that the the practice eligibility route that we discussed looks specifically at training. And after you obtain or you engage in that route, or during that assessment, there is absolutely no assessment of you actually performing clinically. That is the main difference, right? One is assessment of training. It's a paper-based or document-based assessment versus the practice-ready assessment being a workplace-based assessment. They're going to assess you in the hospital or the clinic taking care of patients. So it is commonly mistaken for each other because they're both abbreviated and people start getting mixed on all this spaghetti. But it is very different. One is an assessment of you taking care of patients. The other is an assessment of your documents of training. And I just need to make that very clear. But you may be eligible for one and not for the other, depending on.
And we'll come back to that in a second. But before, as we approach the top of the hour, I know that our expert and friend and regulator from the College of Physicians of Surgeons of British Columbia turns into a pumpkin. And so I wanted to give her just a final minute to make any final comments. And I want to just also take this opportunity to thank her for joining. And I think what's probably the most important thing I hope that everyone on this call and webinar sees is that our regulatory system is here to help and really wants to help international graduates and internationally trained physicians, help them get to licensure so that we can help our patients in Canada. So Corinne, final words from you, and we'll stay on with Filipe and Chantal after you depart.
Thank you so much. I just want to say that, reach out to each jurisdiction or the jurisdictions you're interested in. Email, most of them have a general email registration inquiry, and we can help you figure out what your specific pathway may or may not be. Hopefully it's a may, but we will give you all your options. And I just want to say thank you very much for this opportunity. And it's been great.
Thank you, Corinne. And we will post all the links to the various regulators and all the jurisdictions online. Thank you again, Corinne. Thank you for helping. And we know where to find you as more questions will come up.
Thank you, Corinne.
Bye-bye. All right. And then there were two. We'll see. Hopefully none of you will log off from a difficult question. Filipe, I just sorry to interrupt there. I wanted to make sure Corinne had her last words. Anything else you wanted to say about the practice ready assessment that you didn't get in there?
Just that, you do need, for the practice ready assessment, the job offer is even more crucial because it's not only a job offer, they need to accept and be accredited with the medical regulatory authority as being accredited, sorry, repeating the word, but being accredited to be able to assess you. So a fellowship, for example, clinical fellowship is very different than doing a practice ready assessment. In a clinical fellowship, you're training, and that department providing that training might not necessarily be accredited to be an assessor for independent licensure. So when you are doing a practice ready assessment, that sponsor, so whoever offered you the job or whoever's supervising you, that department has gone through a process with the medical regulatory authority to ensure that the physicians in that department or institution have the necessary training to be assessors, and they will be able to evaluate your training to inform the medical regulatory authority whether or not you're ready for independent practice. And then the medical regulatory authority will make a decision on whether they issue a license or not. Just a very positive information. The College of Physicians and Surgeons of Alberta just released their annual report. And in the last year, so that when they list the practice ready assessment, it is mixed specialist and family medicine. So it's hard to know which ones are related to specialists. But in the last year, they do put there that their pass rate was 100%. So they do a very good job in selecting the people they're going to assess. Doesn't mean that the assessment has no purpose. It is a very strict assessment, but because there are not so many job opportunities, if you do meet all the criteria that is necessary to get that position and you're selected, you are very likely to be prepared, and they will support. They also have support mechanisms to make sure that you are in a good position to succeed. So it is a very positive number to look at.
All right. Well, as we're starting to wind things down, Chantal, I'm coming back to you. luckily we've worked together for many years, so I know how passionate you and your unit are on helping IMGs within the standards and guardrails that you have at the Royal College. Final words to you about how to, and we've heard about sending everything possible, but any other final words of advice about how to be successful in achieving that Royal College eligibility, which is so coveted by many, so that they can again move forward in the pathway to licensure?
Yeah, I think my first thought would be you don't have to do this alone and you're not in it alone. So we want to be there to support you, as I said at the very beginning, from the time of application right through. It is our goal to give you the best experience and provide you the best information that we can right from the very beginning. So I think it's really important to contact us early and often to make sure that you have the information you need. What route is the best for you? And once you know that, what is really important for you to get together before you apply? Um, Make sure that you look into the province that you want to work in to make sure that you know what the requirements are there, because as we've heard, they can all be different. So I think the better prepared that you are from the very beginning, the better off you'll be through the process. But again, we are here to help you through it, through every part of it, right through to certification and beyond.
Wonderful advice, Chantal. And I'll just add, you mentioned so many different interplays, your specialty, the jurisdictions, different routes. And, this is exactly why, as Filipe says, the spaghetti needs a little untangling. We certainly are committed, like the Royal College, to helping untangle that spaghetti. And we certainly have resources on our website, including a book authored by an unknown author named Dr. Filipe Santos that helps a little bit with that. So, Filipe, I'm going to come back to you now and ask, as you hear Chantal's words of advice, and certainly I know you can amplify all the things she said. Any other words of advice for all these specialists on the call?
Yes. I think that spending some time to get familiar with the terminology and the process before you start investing time studying or paying fees for examinations or assessments. Understand where you're going. Have a clear path between where you're now and where you want to get. I find that the physicians that get most frustrated with the system are physicians that are usually attempting things kind of randomly. So they're signing up for the QE1, requesting assessment for training with the Royal College, applying for practice ready assessment without really understanding where they want to get. And sometimes they do not need a specific step or a specific document, and then they're wasting limited resources because all this will cost money on documents or on steps that are not needed. So understand first where you want to get and where you want to go. Understand the difference between some of the terms that might be confusing. So the difference between certification and licensing, the difference between what's internship, what's residency, what qualifies as postgraduate training, what doesn't, what is independent practice, what is not, the difference between a supervised license when you're not the most responsible physician and a supervised license when you are the most responsible physician. Having this basic understanding early on will allow you to better detangle the process and see what's best for you.
Well, thanks to both Dr. Filipe Santos and to Chantal Benoit. Let me close just by saying a couple things. One is that we know we don't necessarily have all the answers, but we are actively working to untangle the spaghetti and make things more clear, as well as to simplify processes. Long and short is we're here to help as much as possible. And so even if you've been to our websites, even if you've been to the Royal College or the College of Physicians of BC or the Medical Council website or any other regulator website, I encourage you not to make it a one and done visit, because as I'm sure all our panelists will agree, things are changing rapidly in this field. And so our commitment to you is to keep bringing that changing information in front of you. And we're committed to continuing to have webinars like this and to be open to your questions and your answers, and do our best to respond. Now, we said a lot in a short hour and 6 minutes, so you may need the opportunity to kind of rewind some of this and have it play out a little bit slower so that you can understand whatever it is that came out today that might apply to you. And so we'll remind you that you will get a recording of this webinar that you can play at half speed or quarter speed so that you can get all the nuances of all the things we talked to. And if for no other reason you want to watch it again, is to watch all the hearts and thumbs up that stream by Dr. Filipe Santos every time he talks, which will make no, which will certainly warm the cockles of his heart. So with that, I want to thank everyone for taking the time today, particularly our panelists, Ms. Corinne de Bruin, who had to leave us a little bit earlier, Ms. Chantal Benoit from the Royal College of Physicians and Surgeons of Canada, and Dr. Filipe Santos, all colleagues and friends, and all working hard for you international medical graduates, internationally trained physicians, all of our organizations. Thank you again for your ongoing dedication and commitment to trying to serve patients in Canada.